Good day, pharmacist. Please, I have a quick question. I know this is your break time. If you don't mind, can I go ahead and ask?
Please go ahead and ask.
Please, I want to know if antiviral drugs are good for pregnant women. If yes, which type of antiviral drugs can they take?
Okay. A good question. I will answer this way. Can you take antivirals during pregnancy? If you're pregnant and your doctor prescribes an antiviral, you might be thinking, will this harm my baby? Should I avoid it completely? Here's the truth. Some antivirals are safe in pregnancy. Some require caution. And some should never be used. Today, I'll break it down clearly, as a pharmacist, so you know what's safe, what's risky, and what questions to ask. Pregnancy changes everything. Your immune system shifts. Your body processes drugs differently. And now, it's not just about you, it's about your baby too. But infections during pregnancy can also be dangerous. So sometimes, treating the infection is safer than avoiding medication. Let's talk facts. Why antivirals may be needed in pregnancy. Antivirals are commonly prescribed for herpes infections, influenza, flu, hepatitis B, HIV, COVID-19, chickenpox. In some of these infections, not treating the virus can be more dangerous than the medicine itself. Antivirals generally considered safe. 1. Acyclovir. Used for herpes and chickenpox. Widely studied in pregnancy. No strong evidence of birth defects. Often prescribed in the 3rd trimester for women with genital herpes. This is one of the safest antivirals in pregnancy. 2. Valacyclovir. Converts to acyclovir in the body, also considered low risk, commonly used for herpes suppression. 3. Oseltamivir, Tamiflu. Used for flu. Pregnant women are at higher risk of severe flu complications. Treatment is recommended, especially in moderate to severe cases. In this case, the benefit usually outweighs the risk. 4. Tenofovir. Used in hepatitis B and HIV. Extensively studied. Commonly used to prevent mother-to-child transmission. Antivirals that require caution, Ribavirin. This one is important. Known to cause birth defects. Strictly contraindicated in pregnancy. Even partners of pregnant women must avoid exposure. If you are pregnant or planning pregnancy, this drug is a red flag. Some newer antivirals may lack enough pregnancy safety data. In those cases, doctors evaluate how severe is the infection? What trimester are you in? Are there safer alternatives? Why trimester matters. First trimester equals highest risk for birth defects. Second and third trimester equals structural development mostly complete. So medication decisions may change depending on the stage of pregnancy. What you should never do. Do not self-medicate. Do not stop prescribed antivirals suddenly. Do not rely on Google. Always speak with your obstetrician, your pharmacist, your infectious disease specialist if needed. Here's what many people don't understand. Untreated viral infections can cause miscarriage, preterm birth, severe maternal illness, neonatal infection. Sometimes, the real danger is avoiding treatment. Final message, if you're pregnant and prescribed an antiviral, ask, is this drug well studied in pregnancy? What happens if I don't treat the infection? Is this the safest option available? Most commonly used antivirals like Acyclovir, Valacyclovir, Oseltamivir, Tenofovir have reassuring safety data. But drugs like Ribavirin? Avoid completely.
Wow, thank you so much, pharmacist, for this information. I really appreciate.
You are welcome. And to my audience watching, before you take that drug, talk to a pharmacist. It could protect you and your baby. If this helped you, like, share, and subscribe for evidence-based health content every week. See you in my next video.